Welcome back. This is personal and professional growth, which is the second part of section 1 in counseling techniques. We'll discuss a couple of topics in this tutorial. The first of those is counselor burnout. Burnout is something that can occur when counselors have been in the field for some time. We'll talk about the signs and symptoms of burnout, how to avoid these, and what to do if they occur. Then we'll have personal growth. Personal growth is where we need to be aware of our strengths and limitations, always aware of what's going on for us in the present so that we can ensure that we are focused and effective as counselors. We'll also discuss a little bit here the recovering counselor, as in addicts in recovery who become addictions counselors and some things they need to be aware of. Then we'll do professional growth, which is where we need to continue to develop our ethical and professional standards, keep educating ourselves, stay up to date with the latest in treatment improvement protocols and evidence-based practices. As a counselor who hasn't done any training for extended period of time will be quite out of the loop. We'll then lastly just discuss credentialing, some guidelines and things to strive towards, and maybe some goals and suggestions from our side on things that you should try to achieve. Okay, so when we get into addiction counseling, what most of us generally feel is very excited about our job, excited at the prospect of being able to help people. We feel motivated, we have a lot of energy, and we want to pursue every little lead that we can, and we want to better ourselves in every way that we can, and we look forward to coming to work. We enjoy the experience. We feel almost honored and privileged to be able to be of service to other people in this kind of area, because it's dealing with life and death stuff. Now, when burnout starts to occur, a lot of the opposite of that starts to happen, and that's when we start to notice. Because we've got to remember, we're dealing with addicts at ground zero in addiction counseling, especially if you're in the intervention stage. Later on in recovery, you'll be dealing with a lot of positive outcomes and really good things that make you feel fulfilled and satisfied with what you're doing. But in the early stages, most of what you're dealing with is problems. Addicts come in, they're doing a detox, they're going through withdrawals, then they're dealing with the rawness of starting to experience emotion, having to then look at the things going on in their lives. So it can be very taxing and very stressful and tedious at times. And when done over extended periods of time, when we're not leading a balanced and healthy lifestyle and leaving work at work, taking on a lot of the issues that we're dealing with our clients, we can then start to suffer personally. So some of the physical symptoms that you'll notice is you'll start to feel tired, and flat a lot of the time, and stressed. So you'll start coming to work feeling like you're not really looking forward to the day, feeling tired all the time, so not really interested, not being able to stay focused. We can also be quite prone and susceptible to illness, getting sick a lot because our body's feeling run down. That can affect us on that level. And then also experiencing frequent headaches, back and shoulder pain, which also comes with a lot of stress and that kind of thing. Now, when this starts to occur, then it's going to start to affect us on an internal level. It's going to be the next step. So that's when we will start to feel, or can feel, a sense of failure, a sense of self-doubt. So because I know I'm not performing as well as I could perform, I start to question whether I'm doing a good job. I start to over-analyze the things that I'm doing, feeling inadequate, feeling like I'm not quite up to spec like I should be. I'll then start to feel helpless, trapped, and defeated. Sometimes we'll start to question whether we made the right decision in becoming an addiction counselor. And I see this happen a lot, where people will be counselors for a period of time, and once they start to experience a bit of this burnout and some of the downsides of what can happen in addiction counseling, they start to then think, well, I've made a mistake. And a lot of addiction counselors at this point will terminate and will go and find some other kind of job, and not really look at it as something that they really just need to deal with on a personal level and move through to get back to how they were feeling in the beginning as an addiction counselor. An increased negative outlook, something that I see happens a lot then when counselors are experiencing this burnout is everything will be negative. So everything they're seeing in the client will be negative. They'll have a negative outlook on, even though a client might be making some good movements in different areas, the counselor will then start to hone in always on the negative areas, and will really have a very pessimistic and kind of cynical point of view when discussing and dealing with the client. This will then also lead to a decrease in satisfaction and a decrease in your sense of accomplishment, because you're not going to feel satisfied with doing good work when you're not doing good work. It's really that simple, and you're not really going to accomplish much, and this is all going to feed into how you're already feeling about not being up to standard. So then the actions that will follow thereafter is we're going to start to withdraw from our responsibilities, and this is where your peers and other counselors will notice that you're not doing those reports quite like you used to. Certain phone calls that you're supposed to make haven't been done because we're detaching more and more and more. Then we will start isolating ourselves from others. And this is where the counselor will start to not spend as much time with their peers as they normally would, not really be discussing things. They'll isolate even by preoccupying themselves with other bits of work. So not discussing things as much as they used to, and just slowly moving more away from the team. And then lastly, procrastinating, never really get anything done. So although they have quite a large workload and are starting to fall behind more and more, they'll then start procrastinating about, I'll get that done next week, or I'll get that done tomorrow. And as this piles up on them, they're going to start to feel worse and worse and worse really about where they're at as counselors. Okay, so remembering that burnout is caused by us really not taking care of ourselves, the first thing is let's try and start each day with a relaxing morning ritual. So rather than just tumbling straight out of bed in a mad rush, throwing on some clothes, eating some breakfast and rushing out the door, let's try and wake up 15 to 20 minutes earlier, and using this time to do something positive and constructive, whether doing some stretching exercises, maybe reading from a book that you find inspirational, or even more useful is try to meditate on your day ahead. Think about the things that you want to achieve during the day, some of the possible problems or obstacles you may face and how you want to deal with those. The more that we do this, once we leave the house and go to work, we're feeling a lot more centered and calm and focused, and especially prepared for the day ahead. Next, we need to adopt healthy eating, exercising, and sleeping patterns. This is very important for us on a physical level, because if we eat healthy foods and try to exercise in any ways we can, whether just going for walks all the way to doing some form of sport, or even running, cycling, or training at a gym, and then get as much rest as we possibly can, we're going to be a lot more energetic and resilient to be able to face some of the problems that life is going to throw at us on a daily basis. Next is we need to set boundaries. It's very important for us not to overextend ourselves. Sometimes we need to know that it's okay to say no to requests on our time. Sometimes saying no actually enables us to be able to say yes to some of the things that are more important to us and that we really want to do. Next, maybe just once a day for even half an hour to an hour is take a break from technology. In today's times, we're all consumed with social media, internet, and texting people, television, and so on. Maybe just once for a little while every day is totally disconnect from everything. Close the laptop, switch your cell phone off, turn off the television, stop checking your email, and just spend some quiet time, whether with yourself or with your family, every day. Another very important thing is to nourish your creative side. Hobbies and creative activities are a massive antidote to some of the stress and the burnout that we can experience in our daily lives. And it's always important for us to maintain some kind of balance between a lot of things rather than just be completely focused on one or two things in our lives. So maybe revive an old hobby, something you used to enjoy doing, or even start a new project, something that you've always wanted to do but have never really gotten around to it. It's important that quite regularly we do something that is just completely unrelated to our work. Lastly, you need to try and learn how to manage your stress. And not everything works for everybody, but you'd be surprised at how much control you can actually have over your stress levels if you just know how to deal and cope with it. When we start to suffer from burnout, we'll start to feel helpless. And it's important that we have some kind of methods and skills that we use to deal or cope with that stress. Some people use meditation, some people do yoga. Sometimes it's even just as simple as having somebody that you can talk to about the things that are making you feel stressed or the things that are going on for you in your life so that you can relinquish some of that burden on a regular basis. Okay, so personal growth, as we touched on earlier, is about us recognizing our own strengths and limitations, being self-aware, and dealing with our own problems and issues on an ongoing basis. It is an ethical responsibility for counselors to always be dealing with their own problems, ensuring that nothing that's going on for them can bleed over into the counselor-client relationship. Some of the massive breaches in ethics that we see in counseling is due to counselors who are not dealing with their own underlying issues or inappropriate behaviors, will abuse the power dynamics or the relationship that's formed between a client and counselor. They'll take advantage of vulnerabilities, they'll give inappropriate advice or behave inappropriately in the counseling scenario. So some of the things we need to be aware of, and similarly to burnout, first of all, is stress management, being aware of our stress levels and finding ways of dealing with stress. And there are loads of ways. And techniques and skills that we can use, from breathing exercises to relaxation techniques. Leisure time is very important. If you're given a lunch break, use that break to have a break. Don't what most people do is use that little bit of time to catch up on some other work they need to do, and as a result they're never really getting that little bit of off time. Secondly, if you're experiencing high levels of stress, it's really a responsibility of yours and quite important to rather approach your supervisor or employer and tell them honestly how you're feeling and request that time off. Because remember that your client is always your first priority. And if the way you are is going to affect your client negatively, then it's your responsibility to deal with whatever's going on for you. Physical exercise and proper nutrition, as we discussed before. On a physical level, we want to have energy. We need the resilience to deal with the problems that we're going to be facing during the day. So if we eat healthy foods and get as much exercise as we can and maintain at least a decent level of fitness, that will add to overall our capability. The importance of discussing personal feelings with other professionals, an AA sponsor, friends or significant others. Okay, because sometimes a counselor also needs counseling. We also need to get things off of our chest, and whether you have somebody at work like a supervisor that you can discuss your own issues with, or whether you have your own counselor or mentor or spiritual advisor, if you're a recovering counselor and you're in a 12-step fellowship, you have a sponsor, you need to utilize everything that you have to ensure that you're okay. And then the last thing, practicing what we preach. As a counselor, you also have a responsibility to be an example to your clients. You can't be telling your clients how they need to seek help and guidance and deal with problems and face problems or walk through fears if you don't do that yourself. If a client witnesses a counselor behaving inappropriately or doing things that go against the kind of suggestions that they themselves are giving the client will lose respect for you, you will lose your credibility, and that will again jeopardize the relationship. Then just a side note for addicts who become counselors. Addicts who become counselors have additional needs that they need to address, and that is their recovery. So aside from all of these things that we're discussing, if you're in a 12-step fellowship and you need to attend meetings, then you need to attend meetings also. If you have a sponsor and you need to speak to your sponsor on a regular basis, you need to attend to that also. Something that I see happen sometimes in rehabs with addicts who become counselors is they feel that because they're working in a rehab environment, they don't need to do all of those other things because they get enough at work. Now remember that work is not your program, work is work. So it's an added bonus that you get to work with other addicts, but you still need to take care of your own recovery. Professional growth, which is just as important as personal growth, is where we develop and grow our level of ethical and professional standards as counselors. And there's a few things to take into account here. The first being skills of the counselor or helper, which is the skills and techniques that we use as counselors, continuing to hone those skills and add new skills to our repertoire. In one of the coming up sections now, we're going to cover about 50 plus of those. And probably after the first time you go through the tutorial, you'll remember maybe 5 off the top of your head. So you'll need to revisit that information as you learn new skills and become comfortable using them in counseling. Then add some more skills, gradually work your way up. The more skills you can use, obviously, the better a counselor you're going to be. The next up is resources for personal and professional growth. And in that, there are so many resources available, especially on the internet. Even on the ACCSA website, if you look in the members area on the resources tab, we have links to all the major organizations where you can find pretty much any information you're looking for. We also have downloadable PDF documents on different topics from theories of addiction, theories of co-occurring disorders, to eating disorders, statistics, all kinds of things that you can use, or information that you may want to pass on to your clients. There's also education and training, which is do as many CEU or continuing education courses as you can, especially in areas that you might be interested in. Try and strive towards achieving some forms of accreditation or certification in your chosen fields. And in this, I guess it's important also to do a periodic self-assessment for professional growth. And in that we mean sit down at least 2 or 3 times a year and really do some planning on where you want to be and what you want to achieve in your education side of your counseling. So what courses you would like to do, what accreditation you're striving to achieve, and then try and meet those targets as you move along. And then lastly is just sources of secure information on the ongoing trends in addiction fields. And I guess that's where you want to try and belong to any organizations you can. And if you're watching this video and you're a member of ACCSA, you belong to this organization, and we keep our members updated with newsletters, posts on the website, and blogs. If you look on the internet, a lot of recovery and addiction websites will have a mailing list. If you add yourself to that mailing list, you'll also receive a lot of good and up-to-date information and articles on addiction or counseling or recovery and so on. Just a little information about certification and credentialing, or maybe some recommendations. The first thing to cover would be continuing education, as that is your base level type of courses or course modules like the one you're doing now and our whole first tier. And these are measured in units, and these are referred to as CEU units or CPD units. Now CEU is the international standard. It stands for Continuing Education Units, or referred to as just CEs. And because ACSA is a NARDAC approved provider, ours are international standard. And because they're international standard, they're also recognized locally by HPCSA. And they have CPD points, which is continuing professional development, so they count as the same thing. Now, the reason we need these is to maintain our skills and education in our chosen field, and these credits are really measured in hours, which we need to accumulate towards higher certifications, similar to as the ones in the IC and RC list of certifications. All of those certifications require a certain amount of those points to even apply. So if you look at the CADC, which is the Certified Alcohol and Drug Counselor certification, you need 270 of those units in order to apply for that certification. Okay, so the IC and RC certifications are pretty much the only international certifications that ACCSA promotes, and there's reasons for that. I guess the first important thing to just say here would be that if you look at addiction treatment around the world, there are many different professions involved. And that would be everything from lawyers to nurses, doctors, psychologists, psychiatrists, social workers, and more. And the real problem that is often faced is that in many of those kinds of qualifications, not a lot of time is really spent on addiction, and then professionals find themselves working in the addiction field with not really much understanding or knowledge about addiction. And so that's where the IC and RC certifications come in. Some of those certifications, a minimum of a bachelor's degree of science would be required to even apply. But knowing that if you're going to work in the addiction field, there are also different areas to work in, from criminal justice to co-occurring disorders, prevention, addiction counseling, clinical supervision. So if you're working in the addiction field, you really want to do the required training and credentialing in your chosen specialization or field.